So, key ingredients impacting healthcare today is that every one of these health insurance plans, whether you're Highmark or UPMC or United Healthcare or Aetna, on the individual side, they all have to comply with the ACA, otherwise known as Obamacare. What that means is that every one of these plans have these 10 categories of mandated benefits called the minimum essential health benefits. They include things, obviously, like emergency services or hospitalization, but they also include things like full maternity and newborn care, pediatric services, including dental and vision care. Now, most of the folks on this call, and particularly the people that really enjoy our program, are no longer in need of full maternity. As you may or may not know, maternity is quite an expensive benefit. So our program doesn't require you to have maternity coverage. In fact, we do not offer it. So unless you're, 35 or 25 years old and plan on having any children, our plan will work just fine for you. In fact, that's part of the reason why it makes it so affordable. In addition to these mandated benefits, is every one of these plans have these, what they call preventative services without any cost-sharing requirement whatsoever. Now, you'll see that they have, like with your ACA plan, you get a free mammography. And I've asked many people what they thought one of those actually cost, and I've heard everywhere from $200 to $500, to have a mammography done. What you don't know is that the actual cost for a mammography is as little as $37. So the fact that your health insurance premiums went up 200-300% over the last couple of years, you're not really getting a free one, right? You're actually paying for it in your premiums. There's also a whole slew of other preventative services like obesity counseling, as well as immunizations for children, young children, health promotion, which includes things like tobacco counseling and domestic violence screening, gonorrhea coverages, and prenatal visits, a whole slew of things. So one of the things I talk about is, if you think about it, there's only 100 pennies in a dollar. And if some of those pennies are going to cover services and procedures that you no longer have need for, there's less pennies available for what might be important to you, like maybe a heart attack or cancer. So we stripped all these mandated benefits out. One of the biggest reasons why Obamacare is so expensive is that every one of these plans are what they call guaranteed issue. In other words, if you're 60 years old and you run marathons, you're going to get the same rate as a 60-year-old that's 750 pounds, a diabetic with brain cancer. There's no underwriting, right? And insurance is naturally, it's supposed to be underwritten. That's how they determine risk, much like a mortgage. Right? If you went to go buy a house and you decided that you were going to have $1,000 that you were going to spend on buying a house, if you have an 800 credit score and have never been late on a bill, you're able to buy more house for $1,000 than you would if you had a 450 credit score with 2 bankruptcies and a foreclosure, right? Because your credit score was poor, the cost for that loan would be a lot higher. Therefore, you would not be able to buy as much house as you could if you had a good credit score. That's one of the biggest reasons why Obamacare is so expensive. So our program is not guaranteed issue. We actually underwrite. We ask some very basic health questions, nothing major. And if as long as you have not had cancer in the last 5 years or have not had a heart attack, you'll probably get issued. That being the case, we're able to provide an awful lot more benefit, much like having an 800 credit score, per dollar spent than you would on an ACA guaranteed issue chassis. So what are the alternatives? Well, we call it our pro-life health plan because not a penny of our dollars go to cover abortions. It's underwritten by a company called Philadelphia American. They're located out of Houston, Texas. They're a fantastic organization. And the key to it is that our program, right, like we said, everybody under the ACA must have these minimum essential coverages. So our plan on purpose is not considered minimum essential coverage. It's not minimum essential coverage on purpose because if it was, it would have all of those mandated benefits that we just talked about that we don't need, like maternity and guaranteed issue. So what does that mean for you? Well, it means that you could incur a penalty, right? The individual mandate or the Obamacare tax, whatever you want to call it. So I hope everybody has a piece of paper and a pen handy. What I would like you to write down is what the fines are. The fine is $695 per person, or 2.5% of your adjusted gross income, whichever is higher. Now, the key to our program is you're not going to pay a fine, but I'm going to teach you about it. So if you think about it, I don't know what everybody's income is, but the minimum fine is $695 per person. So if you divide that by 12, that equates to $58 a month. The easiest way to quantify that is that your fine will be $58 a month or more based upon your income. So I pose a very simple question, one that everybody will be able to answer. If I gave you a choice to choose to pay the fine of $58 a month or more and receive zero benefit from the federal government, not even a tax deduction, or you could choose to become exempt from the fine for $45 a month and receive a benefit, which would you choose? Right? That's a pretty simple no-brainer answer. So one of the keys to our plan is that you have the ability to become exempt. And you'll see here on this screen that one of the exemptions, Publication 5187, spells out these exemptions, and one of them is belonging to a health sharing ministry. There are 4 of them in the country. Most are quite expensive. And because they're not insurance, we don't recommend them as your primary coverage. What we do is we actually utilize this as a tool to get you out of the penalty box. So for $45 a person, maximum of times 3 for a family, or $135 for a family, it gets you out of that penalty box. In other words, it saves you money and headache and gets you exempt from the law. So step 1 of our program is quite simple. Join a ministry. Now there are 4 of them. The one we like is only $45. So step 1, write join CHM, and it's going to do 2 things for you. It's going to get you out of the penalty box, keeping you legal, and provide some additional benefits. But for right now, just write down the term umbrella, right? And we'll get back to that here in just a minute. So for a single person, it's $45. For a husband and wife, it's $90. For a husband, wife, and whether you have 1 or 15 kids, it's $135. Now, it is not insurance. It is nothing I sell. Right? It's a Christian ministry program. It's something I'm educating you about, saying, hey, I'll provide you a link. You can go to this place and sign up for this. Right? So there's nothing I'm paid on, or I'm just referring you there. Okay? So at the top of your page, right, whether you're 45, 90, or 135, out of the penalty box, an umbrella, and we'll get back to this here in a little bit. You'll see what I mean by that. Okay? So some key features of our policy is that it has a $5 million lifetime maximum, and that is per person. That is a ton of coverage. Considering my mom became a diabetic at the age of 32, she unfortunately had probably 20 or so congestive heart failures throughout her life. She had a kidney transplant 15 years ago, and still as yet spent $5 million. So most of the folks on this call are going to be in their 40s or 50s or 60s. There's literally hardly any chance at all that you'd hit that number. With our program, you're able to choose your deductible, your calendar, your maximum, number of units to fit your needs, and we're going to go through this in great detail here over the next hour. What's great about this program is you can go to any doctor, any hospital, anywhere in the country. Our plan is going to pay exactly the same no matter where you go. So you can go to both UPMC and Highmark facilities. The plan's going to work the same. But more importantly, if you did come down with cancer and you wanted to go to Sloan Kettering in New York, you could. Or Cleveland Clinic, or Johns Hopkins. You can go to any doctor, any hospital, anywhere in the country. Our plan is going to work exactly the same no matter where you go. Now, one of the other benefits is that our plan does come with a national PPO. That PPO is PHCS Multi-Plan. PHCS Multi-Plan. It's the largest PPO in the country. It's in all 50 states. Every hospital here in the Pittsburgh area accepts PHCS Multi-Plan. In fact, I've probably checked over 1,000 doctors and have come up with about 30 so far that do not take it. But even then, it really doesn't matter once you understand how the program works. They still take it. Now, what is a PPO? This is a big question. Right? Everybody has heard it. Nobody knows what it is. A PPO is basically a contract, right? It's a preferred provider organization. It's a contract between the insurance company and that provider, whether it be a doctor or a hospital or a surgical center. And it's a contract where the insurance company goes to that provider and says, hey, listen, we'd love to send you a bunch of business. The only thing is, if we send them to you, we want a really good price for your services. It's a pre-negotiated price for whatever service that facility is offering. Now, you can always tell if a PPO is for the benefit of the insurance company or the provider. Here's a great example. If you have a UPMC health insurance plan and you go to Allegheny General, who gets penalized? Right? You do. Right? Your deductibles, copays triple, or they don't even cover it at all. Right? You're out of network. It tells you who the PPO is really, truly for. With our PPO, it actually works differently. We will reprice claims first, and you'll see examples of this as I go through this and go through the claims portion of the program. You'll see what I'm talking about. But it actually does benefit you. Now, next thing is we're going to talk about our program is our deductible. One of the neat things we did is we actually have a split deductible. Most people do not have inpatient hospital stays or surgeries. In fact, it's rare. And if I asked a show of hands, when was the last time somebody was in the hospital, most likely it was been a while or never. Okay? So our program, we offer two different deductibles. The first deductible is the one that you're able to choose. And in Pennsylvania, you could choose $100, $500, $1,000, or $2,500. This deductible is only applicable for inpatient hospital stays and surgeries, the part that we rarely use. So we recommend choosing the highest deductible here. Not only does it save you money, but you'll see with this program, deductibles disappear an awful lot. Regardless of what you choose here, your outpatient deductible for things like doctor visits or x-rays is only $50 per person per year. We're not in the business of trying to collect deductibles. We're in the business of trying to provide very good coverage for a very good price. Now, the other thing with deductibles is typically you have to come out of pocket with that deductible before the benefits kick in. Our program works differently. We're going to figure out the total amount of benefits that are going to be paid, and we're going to subtract the deductible off the back end, very similar to like an auto claim. You wreck your car, the adjuster comes out and looks at your vehicle and says, hey, there's about $5,000 worth of damage here, and you have a $500 collision deductible. Here's a check for $4,500. Go get your car fixed. Now, all of a sudden, we've become good consumers, right? We're good consumers when it comes to almost anything except healthcare. If you buy a house, a car, or a diamond ring, the first question we ask the sales rep is, how much is it? You would never sign a mortgage prior to knowing what the price was. You'd never buy a car before you knew what the price was. You'd negotiate with the sales rep. You say, hey, can you do it for a little less? But in healthcare, we don't do that, right? The doctor says, I want you to go get an MRI at ABC MRI facility, and we just say, okay, we'll go. And we don't even ask. So with us, just like the car, right? If you wrecked your car and the adjuster says, here's a check for $4,500, what do? We pick up the phone and we call our buddy that has a body shop. We say, hey, man, can you do me for $45,000? Right? We shop around. We start asking these questions. So this plan actually puts the control back into your hand of being a good consumer, and we show you and give you a lot of tools in which to do that. So pause for a second here. If we think about it and we look at, say, Obamacare, I pulled up some prices here. Now this here is for a 60-year-old couple, husband and wife, and you'll see some of the prices available. One of the most popular plans is this one here for $3,500 with a $7,350 out-of-pocket maximum. And for a husband and wife age 60, their premium would be $1,596. You have co-pays of $30, $65, $15. I even show you like the absolute cheapest plan that's available. Now this one here isn't available for anybody over 30, but this one here, you're still over $1,000, and you have a $6,950 deductible. So just to give you some ideas of what things cost out there. But let's take a peek here, right? If you had, Obamacare is designed to cover the catastrophic very well, right? The exception, not the rule. If you had a catastrophic claim and the bill was $100,000 and you owed $7,350, you'd be relatively satisfied with your coverage. You'd think, okay, $100,000 bill, I owe $7, that's not too bad. The problem is, catastrophic claims only equate to about 5% of claims. They're the exception, not the rule. The vast majority of claims, 85%, are between $0 and $7,000. Why do you think that number is where it is? Right? They are a broken finger, a tonsillectomy, or a bad case of flu or pneumonia, right? A colonoscopy. They're all under that $7,300. If you had a $7,000 claim and you end up owing $6,000, you're not very happy with your coverage. In fact, most people hate it at that point. So Obamacare, the way I quantify that for us to remember is that it covers from the top down, right? It covers from the catastrophic down. The hole in the coverage is in the very beginning where the vast majority of claims occur. The hole's in the beginning, right? It's where the rule is. So when we designed our plan, we designed it opposite. It's designed to pay from the bottom up. It's designed to cover what's common or normal or average. And the hole is at the top. Okay? So back to the presentation portion, you'll see that we designed a plan, and it actually, I'm going to shrink this down a little bit. Oh, not that much. Right? You'll see here that we're talking about the facility, in other words, the building, the hospital, the surgical center. And you'll see that we have 3 programs, a 1-unit, a 2-unit, or a 3-unit. Kind of like good, better, or best, or bronze, silver, gold. Now you'll see here we're talking about hospital confinement. You're actually in the hospital. And what we found is that the average cost of a semi-private room in the Pittsburgh area is about $1,200 per day. That's the average. So out of 1,000 people, 500 are literally paying less than $1,200 a day. 500 are paying more. And just like any other bell curve, the further you get away from the average, the less likely you are to experience that claim. So of the 500 that are paying more than $1,200 a day, approximately 250 of them are paying less than $2,000 a day, or 75%. Another 100 are paying less than $3,000 a day, or 85%. Of the remaining 15%, they're spread out between maybe $3,500 a day and $4,500 a day. So knowing that, we designed our plan accordingly. We have a 1-unit plan that pays slightly more than the average, and we typically do not recommend that as a standalone plan. We use this typically as a supplement to something like one of these expensive Obamacare plans. Now, some folks have a 3-unit, but in my opinion, even though that is more coverage than I think you need, I think it's overkill. So what I personally have and the majority of my clients have is this 2-unit plan. So for today's purposes, we're going to focus in on the 2-unit plan or the mid-tiered plan. So let's create an example. Let's say you're twice as sick as the average person. If you're twice as sick as the average person, the average fee is $1,200 a day, you're at $2,400 a day, which is going to encompass about 85% of claims. Okay? If you were in the hospital for 10 days and you were twice as sick as the average person, you would have a per-day fee of about $2,400 a day. Times that by 10 days, your facility charge would be approximately $24,000. The great part of this program, and what I mean by bottom-up, is that our plan is going to pay $3,000 a day, and it's going to pay $3,000 a day no matter what. So on that 10-day claim, our plan would pay out $30,000. We would forward $24,000 directly to the hospital, which would pay that claim in full, and there would be $6,000 worth of excess benefit that would be paid directly to you, income tax-free. That's the good. That's what makes this plan great, because it's going to cover the majority of things. So I know everybody's asking, what if? What if I'm 4 times as sick, right? What if I have some odd illness and I'm in the hospital and I'm 4 times as sick as the average person and the bill's $4,800 a day? Well, the bad part is if it was $4,800 a day and you were in there for 10 days, you'd have a $48,000 hospital bill. Our plan would pay $3,000 a day or $30,000. In other words, it would pay out $30,000 and to the hospital, and you would still owe $18,000. Right? Now, this is key to understanding this. You would still owe $18,000. Now, backing up, remember, I told you to write at the top of your pages to join CHM for $45, $90, or $135 a month, and it did two things for you. One, it got you out of the penalty box. But two, I told you to write down the word umbrella. Umbrella meaning that with the Christian ministry, you're able to share, key word here, unpaid medical expenses, and you'll be able to share 100% of those hospitalization or surgical costs up to an additional $125,000 per incident. That's not per person. That's not per year. That's per incident. So if you had a heart attack on Monday, that's an incident. And if you came home and found out you had cancer the next day, that would be an incident as well. Each would have $125,000. Now again, this is just the unpaid portion, right? So from our plan is going to be paying from the bottom up. If you had more bill than benefit, you're able to share those unpaid medical expenses with the ministry, and they're going to pay it at 100%. That is key to understanding. We've had several clients that have had this situation happen and done a fantastic job of taking care of those claims for people. Now, how can they do it so affordably? Well, you'll also notice that it has a $5,000 personal responsibility per incident. Now, it's not insurance, so they can't use insurance terms, but to make it simple, a personal responsibility per incident is very similar to a deductible per incident. So in other words, it's not designed to cover tic-tac claims. It's not designed to cover doctor visits, right? It's not designed to cover the broken foot, right? If you have a broken foot and that bill's $4,000, there's no benefit here. That's why that indemnity from the bottom up is paying first. This is only to cover the top half, or the umbrella or the hole at the top. But once you understand that relationship, you can see clearly that we have you covered for not only from the bottom up, but God forbid you have that very bad sickness or injury. This is covering the hole at the top. Okay? Now, once you understand that relationship, it comes out to be pretty simple to follow after that, right? This is paying from the bottom up. The Christian sharing is covering the hole at the top. If you happen to be in there for injury, it's going to pay $6,000 a day. If you are 4 times as sick as the average person, more than likely you're where? In the ICU, which we're going to be paying $4,500 a day, or $6,000 a day if you're in there for injury. There's a little bit of mental illness and substance abuse coverage should you get, this is inpatient only. Rehab, skilled nursing facility, outpatient radiation and chemotherapy. We actually had a gentleman that had a heart attack and was diagnosed with leukemia at the same time, and this was plenty to cover his radiation therapy. The beautiful thing is, because Obamacare is guaranteed issue, you're always able to pick one of those up, and we actually converted this plan to an income replacement plan, and now that gentleman is receiving $3,000 a month for his radiation therapy, but UPMC is picking up the tab for the care. So it actually saved his house. And if you would ask this young man about our program, he would speak very highly of it because we literally saved his home. Outpatient surgery, ambulatory surgical center, most procedures today are performed on an outpatient basis. Just to give you an idea of just how well this works, I had a friend that got diagnosed with breast cancer. It was a gentleman, by the way. And he went to a place here in Washington County called Tri-State Surgical Center. Tri-State, that facility, charged $2,000 for them to go in and perform that lumpectomy. Now the surgeon, the pathologist, the radiologist, they all had their separate fees. We're just talking about the facility at this point. And he had a 1-unit plan. It paid $1,500. So he owed $500 for that facility. Again, if you have a 2-unit plan, it would have paid $3,000. It would have paid the entire facility fee and cut him a check for $1,000. Okay? Now, conversely, had you had one of these plans and they billed $2,000, how much would you owe? You'd owe the entire $2,000. And so you see what I mean by bottom up. Now, one of the most innovative things that I think we come up with in designing this plan is, I had heard for years, Todd, I've had this health insurance for 15 years. We've always paid our premiums on time, and we rarely used it. We went to the doctor here and there. Finally, last year, my wife had an episode, and the bill was $8,000. And because of the deductible, the co-pays, and all the expenses inside the contract, we end up paying the lion's share of it. We almost paid $6,800. The insurance barely paid anything. We recognized that, and we said, okay, since most people do not have surgeries every year, in fact, it's rare, we will literally waive that $2,500 deductible for the first claim incurred each and every calendar year. We'll waive it. So, again, we're not in the business of trying to collect deductibles. We're in the business of trying to put care into your hands at an affordable price. So we'll waive that deductible if that surgery is performed under general anesthesia. In other words, it's not a little simple mole removal or something in the doctor's office. If you're going under general anesthesia, we consider that a surgery, and we'll waive that deductible for the first claim, and we'll do so each and every year. I don't know of any health insurance plan in the country that does that. So that's our facility fees. The next thing, what makes the plan extra special, is our professional services. That's your surgeon, your pathologist, the radiologist, the assistant surgeon, the anesthesiologist, all the people performing the surgery. Again, we waive the deductible if you go under general anesthesia. You'll see 1 times, 2 times, 3 times the policy fee schedule. What that means is that with an indemnity plan, you have to specifically list what you're going to pay for every particular procedure. Now, when it comes to surgeries, there are 1.5 million different procedures. And for us to specifically list all 1.5 million of them, the policy would be like 3 foot thick. So that's impractical. So what we did is we copy and we'll pay exactly what Medicare will pay for that particular procedure. Right? So every procedure has what they call a CPT code. Again, there's 1.5 million of them, from a pacemaker to a splinter in your eyeball or a broken leg, or there's actually a CPT code for getting hit by a turkey while driving your vehicle, if you can believe it or not. So we will pay whatever Medicare will pay. Now, here's what's important to understand. Medicare doctors that accept Medicare, sign a contract just like a PPO with the federal government saying that they are willing to accept the Medicare reimbursement rate. That Medicare reimbursement rate is typically 70% of what is usual and customary. In other words, if you had an appendectomy and the doctor usually charges $1,000 to perform that appendectomy, if you're 67 years old and on Medicare, the doctor would have to accept the Medicare reimbursement rate, which would be about $700. None of you folks are over 65, so therefore you are not eligible for Medicare rates. So if the doctor charged $1,000 and you had a 1-unit plan, our plan is going to pay $700, you would still owe $3. This is another reason why we recommend 2 units, because 2 units is going to pay 2 times the Medicare rate, or about 140% of what is usual and customary. Right? So slightly more than what the doctor typically wants. So, to recap, you have your facility fees or your hospital, you have your surgical, and then you have your catastrophic. And so that's how we cover the big stuff. Right? Hospital, surgical, catastrophic. Now, moving on. The next portion of the plan is our outpatient benefits, and again, that deductible is only $50 per person. The first thing on the list you'll see is our outpatient physician's benefit, in other words, your doctor visits. You'll see under the 2-unit plan that it says $60. That is not a copay, that is what we will pay. We will pay $60 for that doctor visit. Now, through our PPO, the average cost of a doctor visit is $100. My personal physician charges $90, so when I go, he charges $90, my plan pays $60, I owe $30. If your doctor charged $100, you'd owe $40. If he charged $70, you'd owe $10. Now, we will literally waive this $50 deductible for your first 3 doctor visits, and that's simply because most people don't go to the doctor 16 times. They go once or twice. So again, we're not in the business of trying to collect deductibles. Now, that doesn't count your annual physical. Your annual physical is down here under preventative care. This is the only benefit that has a waiting period. It has a 60-day waiting period, and that is on purpose because we don't want people to buy the plan just to find out if they're healthy and then cancel it. People do that. With our preventative care benefit, we'll pay $125. So the annual physical for gentlemen is typically between $100 and $150, and for gals, if you go to the OBGYN, is between $150 and $200. We will pay $125 for that benefit. One of the nice things about this program is we have some additional things. What we found is that the majority of the time people go to the doctor for dumb things, like the cold or a flu. And you set an appointment with your doctor because you have the flu and you want to get a prescription. You sit in his waiting room for an hour. He eventually looks at you and says, "Yep, I think you have the flu. Here's your Z-Pak prescription. You owe me $100 for the visit." We said, this is crazy. So our program now for common things, and this is your first line of defense, common things like sinus problems or bronchitis or cold or flu symptoms, ear infections. I actually used it because my daughter gave me pink eye. You can pick up the phone, and instead of having to go to the doctor visit and have a fee and a waste of time, you can pick up the phone from anywhere. Called Teladoc. You have unlimited consultations. It's free. It doesn't cost you a penny. I believe UPMC charges $45 for a Teladoc visit. Our plan, it's 100% covered. So this is your first line of defense. Us self-employed, busy people, I got to tell you, this is the best thing ever because before I'm going to go to the doctor, I got to be just about dying. So this is great for like the common things. All right. This is where it starts to get fun. The next benefit is our outpatient indemnity benefits for imaging and things. MRI, that's the big kahuna, right? That's the most expensive. Typically billed out at around $2,600 to take that picture with a magnet. Now, what you'll find is one of the biggest problems in medical billing today is the lack of price transparency, right? Nobody knows what the heck things cost. We sign a mortgage every time we go to the doctor. We sign a mortgage when we go to the hospital saying, yeah, we agree to pay, but we have no idea what it's going to cost. So we start to educate folks about this. And here's a great example. You'll notice that this is for an ankle MRI. And if you happen to go to UPMC Presbyterian in Shadyside, which is part of our PPO, by the way, they will charge $5,640 to take that picture. Now, had you had a UPMC plan with a $3,500 deductible, how much would you owe? Okay, the whole $3,500. What you don't know, and it's what they call the secret price. The secret price is this PPO price, what they actually reimburse that facility for that particular contracted rate through the PPO. So you would pay UPMC $3,500, and then they would reimburse UPMC Presbyterian and Shadyside $1,473, pocketing the difference. With our program, remember I told you our PPO works for you. So if you went to UPMC Presby and they charged $56.42, you handed them your card, it would go through our PPO PHCS multi-plan and would get repriced to $1,473 first. Then our plan would pay $350. In other words, instead of owing $3,500, you'd only owe $11.25. But this is where I get on my soapbox. What do I mean by that? Well, any big ticket item you've ever purchased in your life, right? You've asked the question, how much? But we don't do it in healthcare. So we provide you access to this website. You can actually call our office. We'll do it for you if it's during working hours. But if it's outside of working hours, you can have access to this website for a whopping $60 a year for your entire family. To me, it's worthwhile. Because simply by typing in ankle MRI, we're going to show you a bunch of places and what their prices are. And you'll see that at Monroeville Imaging Center or at Centerville Commons MRI and CT, the cash price for that exact same MRI is a whopping $350. So with our program, we would pay $350. You would actually owe nothing. Just by becoming a good consumer again, the plan works fine. Now, again, you broke your ankle or you cut your arm off or whatever, and it's an emergency and you're not really looking to shop, you just want to get it done and you don't want to think, you're going to get the PPO price. PPO price is usually pretty good. About 50% is the average discount. But if you're able to shop, if you're able to ask some basic questions, if it's not something that is pressing that you have to have done that second, like blood work or an ankle MRI or urine test or whatever, you're able to shop with us, you're able to find that you can find these plans, these prices at significantly lower prices, which makes our plan even work better. Another benefit that we have is called CARES 360. This is an excellent program. I just got off the phone with a couple. Her husband had a heart attack, and he's looking for a cardiologist and a place to get cardiac rehab done. And all they're going to do is contact CARES, and they're going to find them the best place for them to go. And God forbid you have a situation where you have a little bit more bill than benefit, they will actually negotiate those prices down on your behalf. This is a fantastic benefit. It's like your own personal concierge service to help you walk through difficult medical billing problems. Next thing on the list is you're going to see is prescriptions. Just like everything else in medicine today, prescriptions are highly marked up. In fact, you'll look and you'll see a formulary with a traditional health insurance plan, and they'll have things like Tier 1, Tier 2, Tier 3, Tier 4 meds. What you don't know is that the cash price of those meds, 80% of them are actually less expensive than the copay in the formulary, about 20% or more, right? So they balance it out, right? So 80% of the meds actually are less than what the copay is, 20% or more, and that's how they account for the differentiation in cost. So with our program, we provide you 2 websites that give you the best cash price for your prescriptions, and then we will pay $10 or $20 per prescription. Most of the time, it works out better. Unless you have an oddball prescription, like for example Restasis for dry eye syndrome, which is an extremely expensive medication. It's an eye drop that costs $1,000 retail. Now if you have a traditional plan, that type of medicine would be reimbursed at 50%. In other words, you'd owe about $500. With us, we can find that prescription for about $700, and we're going to pay $20. In other words, you'd owe $680. And so it's not quite as good for the oddballs, but for everything else, it actually works better. If you do have an oddball medicine, before we actually move forward, I check those out for you and find out what those costs are to see if it's better for you to go with a traditional plan like UPMC or Highmark, which we do carry, or if it would be better to go with this particular program. My job is to help provide to you the best thing for you. I have no axe to grind when it comes to this. Next thing on the list, you'll see emergency room and urgent care. You'll notice that it's limited to 1 benefit per person per calendar year. It does not mean that you can't go 10 times. It just means we're going to pay the $100 benefit one time, and you're always eligible for the PPO price. This is another reason why we added Teladoc, because most people go to the urgent care for things like cold and flu. Emergency room, you'll also notice it's limited to $200. That is on purpose. Remember, this is an indemnity plan. So if this said $2,000 and you decide to go to the emergency room because you had the flu, we would have to pay $2,000. By doing that, it would make the entire plan cost significantly more. So we limit it to $200, and we cover that hole differently. Most people that have a brain will go to the emergency room for one of 2 reasons. They typically just fell off their roof and broke their leg, or they got run over by a truck, or they had a heart attack or a stroke. We cover it differently because we always add our enhanced accident plan. This will cover 100% of any accident or injury, which is a big difference. Most accident plans only cover accidents. It will cover 100% of any accident or injury, up to $4,000 per occurrence. This comes with an additional $100,000 of accidental death, God forbid, and $10,000 of ground air ambulance, which if anybody's taken a helicopter ride, that's a very expensive trip. It even comes with a $300 per day income benefit for every day that you're in the hospital due to an accident. So God forbid one of you contractors out there, you chop a finger off or fall off of scaffolding, right? You get some compensation. And there's some dismemberment benefits as well, should you do chop something off. Now let's talk about this for an example. Let's assume that you went to the emergency room and the bill was, for whatever reason, $10,000. Now, if you end up being admitted, this benefit's kicking in, you're fine. If you had a surgery, this benefit is kicking in, you're fine. But if you just went to the ER, right, so you had a banged up head or something, they did a bunch of tests on you and then they sent you home, just having the emergency room benefit would only be $200. That's why we always add that accident, because now you're at $4,200. And if you did have that $10,000 claim where you did not have a surgery or were not admitted, remember, Christian Sharing will pay everything over $5,000. So if you had a $10,000 claim, Christian Sharing would pay the top $5,000, you would owe $5,000, and then our accident plan would pay $4,000, and the emergency room would pay $2,000, so you'd have a whopping $800 out of pocket. That is significantly better than what you'd have out of pocket here. The affordability of our program, because it is so affordable, we're able to actually provide health care. What do I mean by that? Well, health care is more than just covering your medical bills. For example, I'm sure many of you are self-employed, and I ask this very simple question. If you had a heart attack and you're laying in the hospital bed for 10 days, what are you not doing? Right? What are you not doing? That's right, you're not working. Mortgage is still due, the car payments are still due, the wife and kids are still hungry. So our program allows you to purchase what we call critical illness or crisis recovery insurance. And this will pay, and you can choose your benefit from $10,000, $20,000, $30,000, $40,000, or $50,000 to be paid out as a lump sum benefit upon diagnosis of a heart attack or cancer or stroke. And this isn't to be used necessarily for your medical bills. It's to be used to keep your life going. I just got off the phone with a woman, her husband who had just had a heart attack, and unfortunately they chose not to purchase this coverage. And she said to me, I'm about to have a heart attack because I'm so worried. He's not working, we're stressing out. I had to bite my tongue because I told him to pick it up. So with the affordability of this, typically we can offer $50,000 worth of critical illness for both the husband and the wife and still be significantly less expensive than a traditional ACA plan at those rates. Now I have to ask, when I say about adding care, you can just imagine, right? Husband's laying in the hospital bed, he just had a heart attack, and the wife comes in, she says, oh, honey, I'm so glad you're alive. Please get healthy, the mortgage is due. Or the other wife walks in and says, honey, I'm so glad you're alive. Please get healthy. Don't worry about a thing. We just got that check for $50,000. Everything's covered. The question I ask is, who is going to heal better? What I mean by care. Actually providing benefit when you're at your lowest point. When you just found out that you aren't immortal. So it's a fantastic opportunity to really provide some excellent coverage for when you need it the most. That's the basis of the program, PHCS Multi-Plan. That is the network. Again, it's the largest PPO in the country. The first claim I'm going to show you is literally the worst type of claim that you can have. I don't know if you can see it. His name is blacked out, but right there it says Thomas A. Marley. That just so happens to be my son. And of course, my son figured out a way to have the worst possible claim that you could have. He actually got bit by a tick. The tick had limes. The limes caused inflammation in his face, and half of his face became paralyzed. They called it Bell's palsy. Of course, my wife didn't know that when she called me on the phone, and she says, Todd, get home right a second. I think Tommy's having a stroke. So, of course, I go flying home, and I run him to the emergency room. And I'm showing you this because, again, this is the worst claim that you could have. He went to the emergency room, and I knew he wasn't going to get admitted because I knew he wasn't having a stroke. And he wasn't going to have a surgery, and it wasn't an accident, and it wasn't a critical illness, right? So, me as a dad, now I know mothers would never do this, but me as a dad, and being in the insurance industry and knowing the kind of shenanigans they pull when it comes to medical billing, I wanted to do a test. Now, I know going in that at any time I can take a claim and run it through the PPO, and the PPO is going to reprice it at about 50%. So I know on this $4,095 claim that if I ran it through the PPO, it's going to get repriced to around $2,100. And then I would follow with the insurance company and we'd pay our benefits for each one of those services. But I said, I want to test something. I want to see what the cash price is. So because this is not an ACA compliant plan, you do not have to present the card. So when I went in, I said, hey, he's uninsured. They said, okay, and they took him back into the room and treated him no different than anybody else. The difference is, this is what his claim would have been, $4,095. And again, if you had one of these plans, you're out of pocket just about that entire $4,000. I said he's uninsured. They gave him an uninsured discount, which in other words is saying their cash price was $1,187. I then filed it with Philadelphia American, who paid me $15 for the lab, $350 for the CAT scan, $200 for the emergency room, $15 for the drugs, and $70 for the electrocardiology. He ended up being out of pocket about $300, as opposed to over $4,000 had he had an ACA compliant plan. Now this is, again, the worst dang thing that could happen. Because if you would have been admitted, right, these benefits would have kicked in. If you'd have had surgery, these benefits would have kicked in. If it was an accident, these benefits would have kicked in. And God forbid if it was a critical illness, these benefits would have kicked in. Some additional claims. This is the gentleman that had the lumpectomy. He went to Quest Diagnostics, which is part of our PPO, to get some blood work done. And you'll see there are 6 labs there. Typically, you have a $25 copay per lab. So on this $522 bill, you would have a copay of around $150. And you'd be happy because you only owe $150 on a $522 bill. What you don't know is that secret price, because they don't show it to you, we do. The actual secret price is $88. In other words, that's your PPO price. And then our plan paid $15. So the gentleman only owed $74 on a $522 bill. If he would have had regular health insurance, he'd have owed $150. So here's a good trick question for you. How much did the insurance company actually pay if you paid $150 in copays? Right? They paid nothing. You actually paid them $70 to process the claim. Here's 3 more labs, $183. The actual cost was $21.43. Plan paid $15. He owed $6. This is an annual physical for my daughter. She went to the OBGYN and they charged $240 for that doctor visit. That's what most people see. And of course, they either have a $50 copay or whatnot. What they don't see is the secret price. That's the PPO price, which was $81. So if you had a $50 copay, the insurance company literally only paid $31. With us, our plan paid $125. Paid $81 to the provider, which covered that claim in full, and then she actually got a check for $44. She literally texted me and like, hey, is this for real? I'm like, yeah, it's for real. You can cash it. Here's the gentleman that had the lumpectomy. Now think about it. This guy had breast cancer. I don't know if anybody's had any major claims before, but an EOB for breast cancer is typically about 6 or 7 pages thick. Ours is 1. They charged $2,000 for that procedure at that facility, Tri-State Surgical Center. This gentleman had a 1-unit plan that paid $1,500. He owed $500. Way less than what the deductible would be on a traditional plan. Had he had a 2-unit plan like we recommend, it would have paid $3,000. This would have been zeroed out, and he would have got a check right here for $1,000. Here's the surgeon. He billed $564. The PPO discount was $257, and our plan, paying 1 times Medicare, was $222. Left an $84 out of pocket. Again, we recommend 2 units. Would be $446. This would have been zeroed out, and he would have got a check. Now, on a claim like this, having an $84 out of pocket is no big deal, but if you had a $10,000 surgery, all of a sudden that would be a bigger number. Again, we recommend 2 units. Here's a colonoscopy. This gentleman had a couple polyps removed. They billed $27.34. The PPO price discount was $546. Dropped the bill to $21.87. An outpatient colonoscopy is outpatient surgery, and he was under general anesthesia, so the deductible was waived, and our plan paid out $3,000, which paid that claim in full and cut him a check for $812.56. Had he had 1 unit, it would have paid $1,500. He would have owed $687.44. This is the most important claim on the sheet. You recall in the very beginning I said that the average cost of a semi-private room in Pittsburgh is about $1,200 a day. This poor guy was in Washington Hospital for 11 days, 7 days in the ICU due to a bowel obstruction, and the bill was for $56,000. Now I got to ask a question. If you're in the hospital for 11 days, 7 of which you're in the ICU, would you consider that average? Of course not. That's way above average, right? Average person might be in there for 1 or 2 days. Certainly not in the ICU. Now, if you take that 11 days, the $56,000 bill, it was actually repriced to $12,235.68. That's the actual price. This $44,000, which is your PPO discount, another way of saying that is markup, right? That is fat and profit built into the system. That's where they're bilking the insurance companies. And if you take $12,235.68 and divide it by 11 days, that comes out to $1,100 a day. So when I tell you 1,200 is a good average, it's a good average. Now, this guy did not have general anesthesia, so his deductible applied. Just like an auto claim, we subtracted off the back end. Our policy actually paid out $21,750. They took the deductible off the back end, which left a total payable of $19,250. See what I mean by the deductible disappearing? Because it paid out $12,235 to Washington Hospital, which paid the claim in full. He had nothing out of pocket. There was actually $7,014 of excess benefit that was sent directly to him. He used it to pay off his pickup truck. And I could show you claims who are blue in the face. What I would like to show you, though, is a quick video. Dr. Keith Smith and I became friends a couple years ago. He is a client. Dr. Jason Sigmund, another gentleman in this video, is a client as well. Became friends with them, and I found out that what they were doing. I said, my gosh, this is the best thing. What they're doing is really taking the lid off of what the problems are in medical today. And I told him, I said, we developed this health insurance program. I think you'll love it. And he looked at me. Well, he didn't look at me. He said over the phone, he says, Todd, he says, are you an insurance agency or an insurance company? I said, yeah. He says, I want nothing to do with you. You are all crooks. I said, oh, Dr. Smith, I'm telling you, what I got here is something different. We stayed on the phone. He says, where are you from? I said, I'm calling you from south of Pittsburgh. He says, you're kidding me. I'm flying into Pittsburgh next week on Thursday to speak to the Free Market Medical Association in Station Square. Would you like to attend? Of course. I went down and I sat through the presentation. It was off the charts good. Then him and I sat in the lobby for about 4 hours talking shop. I actually rode him to the hospital, or to the airport. So we are now the only health insurance plan endorsed by the Free Market Medical Association in the country. You're able to go to any of their facilities. The closest one is in York, PA, but I've had people actually go to Oklahoma because it was the best deal. You don't have to by any stretch, but this will show you exactly what I'm talking about when it comes to medical billing. So I'm going to pull this off, and I'm going to let you listen to this quick 6-minute video. It should answer a lot of the questions that you may have. And then I'm going to pull up some basic rates to give you an idea of what this costs. In fact, I'm going to scratch the video for right now. That's a waste of time for right now, right? But Oklahoma Surgical Center Reason TV, I strongly encourage you to Google that. You can find it on our website on the Pro-Life Health Plan under Media. So go ahead and check that out. What I'm going to do is I'm going to show you some basic rates. Okay, now remember you have the Christian sharing, which is either going to be $45 for a single, $90 for a couple, $135 for a family. That is separate. So let's pull up a quote. Okay, and let's say here 15317, male, and let's make him 60 years old. So that'd be what, 1957. Non-tobacco. 5'10", 180, and his wife, Mrs. Spouse. They just happen to be born on the same day. And let's say she is 5'5", 125. All right. So typically we recommend the 252-unit plan with the $2,500 deductible. The total premium for both the husband and the wife, $540.48. Again, comparing that to these numbers, it's a steal. And you can see that we adequately cover things that are important. We're adequately covering and providing much education on how to do this correctly. Again, you don't have to. It's just recommended that you do, because if you do, it'll save you a lot of money. You think about it, for this particular family, I would be saving them over $1,000 a month $1,000 a month, that's $12,000 a year. So if they went to the doctor and the doctor decided to charge them $120 and we paid $60, and instead of you having a $50 copay, you have a $60 copay, who cares? Right? So we're able to strip all those mandated benefits out. We have an underwritten chassis plan. It's completely legal. It's completely moral. You're outside the penalty box. You're not liable for the fine. And we're able to provide you these kind of benefits for that kind of price. Now, there's other things that you can choose. For example, you can choose to add critical illness, accident, right, dental, all these things. And it becomes a very, very good chassis from which to work from. We've been writing this policy for 4 years now, and I got to tell you, we've had some doozies. You know, like I said, one gentleman had a heart attack and leukemia. Just had another gentleman have a heart attack. We've had bowel obstructions. We've had cancer claims. It does a phenomenal job.